Understanding cystic fibrosis, a life-changing genetic disorder. Cystic fibrosis, or CF, is a genetic disorder. It affects the cells that produce mucus, sweat, and digestive juices. Normally, these fluids are thin and slippery, but in people with CF, a faulty gene causes these fluids to become thick and sticky. The sticky mucus builds up in the lungs, digestive system, and other organs. This buildup leads to severe problems. It causes persistent lung infections. It also obstructs the pancreas, making it difficult to digest food. CF is a life-limiting disorder that requires daily care. Despite the challenges, there is hope. Scientists are constantly working on new treatments for CF. They are making great progress. New therapies offer the promise of a brighter future for people with CF. Inhaled gene therapy, a beacon of hope for CF patients. One of the most exciting breakthroughs in CF treatment is inhaled gene therapy. This therapy targets the root cause of CF, the faulty CFTR gene. This gene provides instructions for making a protein that regulates the movement of salt and water in and out of cells. In people with CF, the CFTR gene is mutated. This mutation disrupts the normal function of the CFTR protein. Inhaled gene therapy delivers a healthy copy of the CFTR gene directly to the lungs. This delivery helps the cells produce functional CFTR protein. This protein can then correct the salt and water balance, thinning the mucus and improving lung function. Currently, a new inhaled gene therapy called BI 372093-1 is showing promise in clinical trials. It's designed for patients who don't benefit from existing CFTR modulator therapies. These modulators are drugs that help improve the function of the faulty CFTR protein. However, not all CF patients have mutations that respond to these modulators. New discoveries, new hope, unraveling the mechanisms of CF. While gene therapy offers a potential cure, scientists are also exploring other avenues to treat CF. Researchers at the Hospital for Sick Children, also known as Sick Kids, recently made a groundbreaking discovery. They found that CFTR proteins organize themselves through a process called phase separation. This process is crucial for the proper functioning of the CFTR protein. Disruptions in this organization contribute to the development of CF. This discovery opens up a whole new approach to developing CF treatments. Scientists can now focus on developing drugs that specifically target this phase separation process. By restoring the normal organization of CFTR proteins, these drugs could potentially treat CF in patients with different mutations. In addition to these breakthroughs, researchers are also investigating existing medications for their potential benefits in treating cystic fibrosis. One such medication is melatonin, a hormone naturally produced by the body to regulate sleep. Recent studies have shown that melatonin possesses anti-inflammatory and antioxidant properties. These properties make it a promising candidate for managing cystic fibrosis symptoms. In a study using a cystic fibrosis mouse model, melatonin effectively reduced lung inflammation and improved bacterial clearance. While these findings are encouraging, further research is needed to determine the optimal dosage and long-term effects of melatonin in cystic fibrosis patients. If proven effective, melatonin could be a valuable addition to the existing cystic fibrosis treatment regimen. The future of cystic fibrosis treatment is filled with hope. With the development of innovative therapies like inhaled gene therapy, the discovery of new drug targets, and the exploration of existing medications like melatonin, we are on the cusp of transforming cystic fibrosis care. These advancements aim to not only manage symptoms, but also address the root cause of the disease. They hold the promise of extending lifespan and improving the quality of life for individuals with cystic fibrosis. With continued research and collaboration, we can strive for a future where cystic fibrosis is no longer a life-limiting disorder.